Hi folks, Dr. Jeffrey Roth here, your board certified plastic surgeon in Las Vegas, Nevada, and we get questions. One of the questions we get a lot is, what's up with labiaplasty? Why do women get them, etc., etc., etc. Okay, so first of all, labiaplasty has been more and more popular as of late, as women are wearing yoga pants a little bit more. We've been hearing about that. We've also been hearing about spin class, and so sometimes things can be a little bit uncomfortable and that sort of thing. So what we do with a labiaplasty is like anything else. We get a history, we take a look at the physical exam, etc., etc. And oftentimes with a labiaplasty, you have the labia majora, which are over on the side, and then you have the labia minora, which are more medial or centrally located. And this tissue here, sometimes after having babies or for whatever reason, may be a little bit elongated or sometimes asymmetrical. Sometimes you can see it in tight-fitting clothing. Some folks don't like seeing it or having to deal with that during spin class, etc., etc. So there's a variety of reasons why people come in. But that's typically what we would be addressing. So we would take a look and see really, is it normal, not normal, is it a variation of normal? Can we go ahead and see what goal we want to get to, or what aesthetic the woman wants to get to. So we take a look at et cetera, and there are many, many different ways of doing the technical part of the operation. Some folks do fancy flaps, some folks more of a straight line closure, et cetera, et cetera. Really, again, just depends on the patient. There's also the area around the clitoral hood, which is, again, a whole another topic of do we want to go ahead and trim any tissue around that, et cetera, et cetera. So, okay, so we decided that patient's a candidate, we go to the operating room. For me, I like to do most things under general anesthesia, and so that way the patient goes to sleep, she wakes up, hey, everything's done already, et cetera, et cetera. We go ahead and we trim off or do the flaps or whatever we do technically in the operating room. Patients wake up afterwards. We have a little bit of dressing for them, et cetera, et cetera. One of the secrets is a spray bottle as opposed to wiping afterwards, and so there's always a little trick or a tip or something along those lines. And then, of course, we see people back at day 3 and then day 7 and then our usual sort of post-operative program. We've been very fortunate in our experience that people really do like this operation for a variety of reasons, and people are usually really, really happy with it. And now people are talking about it more than they ever have before. So if you have any questions about this particular procedure or anything else plastic surgery or aesthetic medicine wise, give us a call.